If your cat has recently started dropping pieces of food out of the side of their mouth, or if they suddenly pull away when you try to gently stroke their cheeks, you are rapidly running out of time. You probably thought they were just becoming a picky eater, or maybe you have just learned to tolerate their toxic, rotting fish breath as a normal part of getting older. But as a feline specialist, I am telling you right now, that is not a cute behavioral quirk. It is a silent, systemic emergency. Your cat is in agonizing, radiating nerve pain, and they are desperately trying to eat around a massive bacterial infection that is currently eating away at their jawbone. If you click away from this video, that invisible infection is going to breach their bloodstream, permanently scar their kidneys, and land you in an emergency room facing a highly dangerous $1,500 anesthetized surgery. But if you stay with me, we are going to stop this cellular breakdown in its tracks tonight. I am going to show you how to beat feline dental disease and completely eradicate bad breath for good. And we are going to literally melt away that calcified plaque using exactly 2 ingredients from your kitchen pantry for less than 50 cents a week. Welcome back to the Smart Cat Parent community. I am Dr. Whiskers. I see how hard you work to give your indoor predator the best life possible in a complex modern world. If your cat's breath smells bad, I need you to take a deep breath and let go of any guilt you might be holding on to. You are not a bad parent. You have simply been the victim of a multi-billion-dollar pet food industry that profits off your cat's biological decline. In this video, I am going to reveal exactly why the commercial industry has set your cat up to fail. By the end of our time together, I am going to explain why your cat suddenly stopped playing with their absolute favorite plush toy a few months ago. I will completely dismantle the dental kibble deception that is secretly eroding your cat's enamel as we speak. And most importantly, I am going to hand you a $1 kitchen solution that literally melts away dental calculus at a microscopic level. But to save their teeth and ultimately their vital organs, we must first understand the invisible war happening inside their mouth right now. To understand your cat, you must remember their origin as highly specialized, solitary desert predators. In the wild, showing pain is a death sentence, which is why your cat is a master of hiding profound suffering. When we smell tuna breath or garbage breath, what we are actually smelling is a highly toxic, volatile sulfur compound. This compound is excreted by billions of anaerobic bacteria, primarily a strain called Porphyromonas, colonizing the tiny dark space between your cat's tooth and their gum line. This space is called the gingival sulcus. As these bacteria feed, they secrete a thick, impenetrable biofilm that hardens into calcified plaque. Imagine a microscopic acid-spewing factory operating 24 hours a day, burrowing into the periodontal ligament that anchors your cat's tooth to the bone. But the true danger isn't just tooth loss. When those gums become inflamed, the capillary walls become permeable. Every time your cat chews, they are forcing millions of highly aggressive bacteria directly into their own bloodstream. This toxic bacterial shower travels straight to the feline nephrons, the microscopic filtering units inside your cat's kidneys. Over time, this constant immune assault triggers micronecrosis and cellular scarring. It breaks down the delicate protective GAG layer in their bladder. It sends repeated, exhausting adrenaline spikes straight from the amygdala to their adrenal glands, keeping them in a chronic state of low-grade panic. That bad breath isn't just a mouth problem. It is silently destroying their kidneys and stealing years from their lifespan. But you are a smart cat parent, and tonight, your living room couch becomes a clinical diagnostic laboratory. You don't need a veterinary degree to catch this before it becomes an emergency. You just need to know exactly where to look. First, we are going to perform the Q-tip glide test. Wait until your cat is completely relaxed, perhaps dozing in a sunbeam or purring on your lap. Gently lift their upper lip just enough to expose the premolars in the back. This is where the plaque factories always set up shop. First, take a sterile, dry Q-tip and very gently glide it along the gum line where the pink tissue meets the white tooth. If that Q-tip comes away with even a microscopic speck of pink blood, your cat has active system-breaching gingivitis. Second, we are going to decode their internal infection status using the maxillary lymph node palpation. Slide your fingertips right up underneath their jawbone, just below the back corners of their mouth. In a perfectly healthy cat, you should barely feel anything, perhaps 2 tiny soft bumps the size of a split pea. If you feel hard, swollen lumps, roughly the size of a small almond, their immune system is actively fighting a massive periodontal infection. Your cat's body is screaming for reinforcements, and now we are going to provide them. Remember that $1 kitchen solution I promised you earlier? We are going to create a veterinary-grade biofilm-busting compound using exactly 2 ingredients. Ingredient number 1 is pure organic Ascophyllum nodosum, commonly known as Norwegian kelp powder. This is not a gimmick. It is a scientifically proven cellular disruptor. This specific kelp contains a harmless, beneficial bacterium called Bacillus licheniformis. When your cat ingests this, it systemically enters their bloodstream and is secreted outward through their saliva. It releases a powerful protease enzyme that literally dissolves the structural matrix of the plaque biofilm, turning rock-hard tartar into soft mush. Ingredient number 2 is unrefined, cold-pressed virgin coconut oil. Coconut oil contains up to 50% lauric acid, which acts as a devastatingly effective localized antimicrobial agent against gingival bacteria. Here is your precise daily clinical protocol. Take exactly 1/8 of a level teaspoon of the kelp powder. Mix it thoroughly into a small 2-ounce portion of their wet food or a high-quality meat-based lickable treat. Once a week, take exactly 1/4 teaspoon of the solid coconut oil. Simply let them lick the coconut oil right off your finger, or lightly rub it onto their front gums if they allow it. At an average room temperature of 68 to 72 degrees Fahrenheit, the coconut oil remains solid enough to coat the teeth before melting. Within 3 weeks, that systemic enzyme will begin to crumble the tartar, and the bad breath will permanently vanish. But before you rush to your pantry, I must issue a severe, life-saving warning. There are lethal traps disguised as solutions everywhere, and we must navigate them perfectly. Let us close that loop about the commercial dental kibble deception. The industry
So this
tells
is the
you
dry
that
food we
large,
discussed.
crunchy kibbles
Notice the
scrape
size.
the
It
teeth
encourages
clean
them
like
to
a
chew
toothbrush.
thoroughly.
This is a biological impossibility. Cats lack the flat molars required to grind their food. Their jaws strictly hinge up and down like a pair of scissors to shear meat. When a cat bites down on a dental kibble, the kibble shatters instantly. Worse, those kibbles are packed with up to 40% complex carbohydrates. When those carbs mix with feline saliva, they instantly convert into sticky sugars, perfectly feeding the exact anaerobic bacteria they claim to destroy, and never, under any circumstances, attempt to use human toothpaste, dog dental water additives, or essential oil sprays on your cat. Human dental products contain fluoride and xylitol, also known as birch sugar. Even a fraction of an ounce of xylitol will trigger a massive artificial insulin dump in your cat, dropping their blood sugar to fatal levels within 30 minutes. Essential oils like clove or tea tree, heavily marketed as natural dental remedies, are deadly neurotoxins. Cats genetically lack the liver enzyme UDP, glucuronosyltransferase, meaning they physically cannot metabolize the phenols in these oils. Trying to freshen their breath with these natural oils will induce acute liver failure. Stick strictly to the kelp and coconut oil protocol. Now let's solve our final mystery. Why did your sweet cat suddenly abandon their favorite plush toy? Because cats capture prey and toys using their highly sensitive canine teeth and premolars. When those teeth are secretly decaying beneath the gum line, the sudden pressure of biting down sends a localized shockwave of blinding nerve pain straight to their brain. They drop the toy, they walk away, and they suffer in silence. While the kelp goes to work over the next few weeks, I want to give you a powerful Eastern veterinary medicine tool to soothe their pain instantly. It is an acupressure point known as stomach 6 or ST6. It is located exactly at the angle of their lower jawbone, where the masseter muscle bulges when they chew. Using the pads of your thumbs, apply incredibly light, rhythmic, circular pressure to this point on both sides of their jaw for 60 seconds. This specific acupressure point releases localized endorphins, physically numbing dental pain and halting that toxic adrenaline spike from their amygdala. You will actually feel them lean into your hands and sigh as the relief washes over them. You have the power to protect them, to extend their lifespan, and to give them back the joy of a pain-free life. If this video opened your eyes and helped you understand your cat's secret world, I need you to subscribe to the channel right now. Your subscription helps us defeat the industry algorithms and push this life-saving feline medicine to millions of other cats suffering in silence. Before you go, I need to know exactly who I am treating today. Go down to the comment section right now and tell me, what is your cat's exact age and what kind of food are they eating right now? I am Dr. Whiskers, and I will see you in the next appointment.